welcome to the Ann and Ashley Show. I'm Ann.
I'm Ashley.
And before we get started on today's episode, please like and subscribe to these videos. And if you're on YouTube, you can hit the little notification button so you are sure to never miss an episode. On today's episode, we are going to be talking about these devices here. These are called audio-visual entrainment devices. And a few weeks back, we were lucky enough to have the developer of this technology come to the clinic and discuss what this is and how it could be potentially beneficial to our patients here. So it was really intriguing, and after our conversation, we brought these into our clinic so they now are a therapy that we offer here. But these devices are made so that you can do these therapies at home as well. So they are available on our web store. So What is audiovisual entrainment?
It utilizes these cool glasses.
Yes.
And then it also utilizes soundproof headphones. With this therapy, it comes with this device here that you programmed the program that you want to run, which has specific frequencies in it. The glasses will then be emitting and flashing different, either a different color of light, or it's going to just be whatever program you have. It could be one side of the glasses or both sides at once for stimulation. You will have your eyes closed for this as well. And then the headphones will be having it sounds like a heartbeat noise, but it's going to have pulsing sounds coming through those. And it's going to help you so you can breathe deeply and kind of more calmly as well. So you're going to just pick a non-disturbance environment for about 20 minutes or so for this therapy, and then you just relax. That's all you do.
Right.
Your brain does the work. It is also meant to mirror the frequencies your brain does that are being stimulated with the device. So our brain patterns is our norm, and we get stuck in those patterns, so it can be hard to break them. And so the training device then, it kind of, when it mirrors the frequencies, forces your brain to create these new pathways. And so any brain symptoms that you're experiencing can then go into a new path, and you break the norm that you have for that symptom.
The pattern.
Yeah, the pattern.
Yeah. Yeah, so talking about different brainwaves and different patterns, so we have 4 different brainwave types. We have alpha, theta, delta, and beta. And a normal healthy brain can kind of switch between these different patterns depending on what the task is at hand. So the sleeping brainwave patterns are the alpha and the theta, and then the focused attention, test taking, reading is the beta brainwave. And so when we see kids who have ADD, their brain is in the dreamy, sleepy, theta pattern when you're supposed to be taking a test, and in the beta pattern. And so these devices have been, proven. There's research and studies, and that's part of what the developer that we spoke with, he spent his career in the school systems tweaking and developing the technology to specifically help these kids who have ADD and autism. And so he, just based on their responses and their patterns, this is what he has put together and seen the studies that back the improvement with this device. So it was really intriguing to listen to him. And there's different things that can stimulate the inappropriate brainwave patterns, whether it's something that has been in our environment that we're exposed to, whether it's a stressful event, a traumatic event, whether there's a genetic piece. So there's all of these pieces that can disrupt the normal brainwave pattern. And then again, if you're stuck in a specific state, then that's when you have these symptoms. So this device helps realign those patterns so that your brain can jump from one to the other in a healthy manner.
Yeah. So some of the uses that are really researched with this device would be like PTSD, anxiety, depression, insomnia, mood disorders. It has been studied with Alzheimer's and dementia as well. It can also help seniors with their balance and their mental clarity. It can help college students with learning and memory. ADHD, of course, like you mentioned before, ADD. And then the researcher also worked with a lot of autistic children when he was working in the schools. So the testimonials for that were really far and beyond what he could imagine. So really good studies under the autistic part as well. You also mentioned the mental health piece of the traumatic disorders too.
Right. Yeah, so he talked a lot about, okay, so when we experience trauma, it's stored in our bodies. And this can be, trauma that you remember, or trauma that maybe something happened when you were a baby in a stroller. Maybe all of a sudden a dog started barking, and as a baby, that trigger or that memory, and so as an adult you don't know why, but you don't like dogs. So that's, not like hugely impactful in life maybe, but you just don't even know why you don't like dogs. And so what he was saying is, for some of these traumatic experiences, when you go to a psychologist or psychiatrist and you do the talk therapy, which is hugely beneficial, but for some people, maybe bringing some of those traumatic experiences to cognition is maybe not for everyone. Maybe that's why some people don't go. They don't want to relive those experiences. So this is a way to help those people deal with those traumatic events, because it just allows the body to work the trauma out naturally through the nervous system. So through this entrainment, your body is resetting and able to release those traumatic events without bringing it to cognition. So I think that can be helpful for so many people as well.
It's very powerful.
Right, and you can do it in the comfort of your own home, which I think is huge for compliance. People don't always have the time in the day, or it takes effort to go make an appointment or something. So to be able to have this in your home and do it 20 minutes a day, whenever it fits in your day,
which could be equivalent to 4 hours of sleep,
right? Yeah,
which is super cool.
Yeah, he has said that he doesn't get very much sleep, but he uses this, and so 20 minutes of this can be equivalent to 4 hours of sleep.
And it can tap into your subconscious mind and just really put your whole body at that relaxation, that resting state.
Right, which is where you heal. And so obviously we are a cancer clinic. Most of our patients have cancer or autoimmune disease. And so they're stuck in that stressful fight or flight mode. And our bodies don't heal well in that mode. We need people in the rest, digest, and heal nervous system. And so this helps you get there, which allows your body to heal from cancer, heal from autoimmune disease, heal from these other issues that that people experience, seasonal affect disorder. I think you mentioned that. Here we are heading into the winter months where I already feel it, starting to get dark earlier, and I just get the blues, and that has to do with melatonin production. It can disrupt sleep, and then it's the cycle of events, and so this can help with seasonal affect disorder.
And pain, too, because being in a state of pain, your brain then is kind of shut down because you're so focused on the pain. So getting your brain to get in that restful state, then hopefully the pain management can be alleviated as well.
Right. So really cool. I feel like every single person in my family or that I know can benefit from this. So we're really excited to offer this in the clinic and to our patients. So
it is now our turn to go do this. I need my 4 hours of sleep.
Yes. I didn't get a lot of
20-minute therapy.
So that's it for today, folks. Ashley and I are going to take off. If you need any help with nutrition or genetics, you can call the clinic. Or if you have questions about the device, the first consult's always free. Share this with your friends. I'm sure you can think of plenty of people that need this device in their life as well. So off we go. Brain entrainment. See you next time.